And welcome back, everyone. It seems as though cancer has affected almost every single one of us in some way or another, whether you've been diagnosed yourself or maybe you have a loved one that is battling cancer right now. Well, Dr. Niki Barr is a pioneering psychotherapist and author. Her new book, Emotional Wellness, The Other Half of Treating Cancer, is bringing so much hope and encouragement to cancer patients and those who love them so much. And we're so happy that you're here this morning.
Thank you. I'm so happy to be here.
Thank you for being here. I guess I just want to ask you first why you wrote this book and focused on this specifically.
I wrote this book, Kimberly, because cancer has really been focused on the medical treatment, as it well should. But our emotions play a huge part when you're freaking out and you're just sad, you're despairing, you're angry, you're all those things. Mm-hmm. So we really need to pay attention. It's a two-part thing. It's medical treatment and emotion.
Yeah, I think you're right. People are so focused on the medical that they don't think about the psychological. They don't think about the emotion and the emotions of the people who love those who are battling cancer, because that has got to be so incredibly hard.
Very much so.
So you're very specific in your book, and I love this. We like specifics around here. Tell us exactly what to do, and if we could, can we go over some of the tips that you give? Now, you give top 3 ways for patients to cope emotionally following a diagnosis. So this is specifically for patients.
Yes.
What do they need to do?
Well, they need to take time to get their heads around, their hearts around, themselves around a cancer diagnosis. A cancer diagnosis is an emotional shock. And typically what we want to do is fix it right away. We want to go in with surgery or chemo or radiation or all of it. And you want to give yourself time. You want to pay attention to your breath. Now, that's the last thing you feel like doing because you're just trying to keep breathing.
What does that mean, though, pay attention to your breath? What do you mean by that?
There are tools in my book that you can learn quickly and easily and take with you to the doctor's office, the waiting room, whatever difficult conversation with your family member, to help you relax, because we know it's a well-known fact that you can't be physiologically relaxed and stressed at the same time. You're not going to be relaxed.
Maybe to help relieve a little of the anxiety and the stress of it all. You also list the top 3 most significant contributions that a family member or a loved one can make for someone who has just been diagnosed. So for someone who, like you said, is just, hit with the shock of their lives, what can we do to help that person that we love so much?
Yes, the most important thing is to listen. Cancer patients, like all of us, every kind of disease, but all of us in general, want to be listened to. And it means not only turning off your computer or your telephone, but also looking at the person, taking in what they're saying, their body language, listening. We know what it feels like when we're listened to, and that's what we want to give back.
You're absolutely right. Everyone's always distracted these days if they're not checking their text messages or doing this. So you're saying focus, listen, and be present in the moment with that person. And you also list the top 3 problems that most interfere with a cancer patient's emotional health. And what would those be?
Yes. Well, jumping in too quickly, again, you want to give yourself time. If you have a day, a week, hours, whatever, to think through this cancer, to get your arms around it, because jumping in too quickly really results in a lot of regret, I think, in the end.
Yeah, so this is the second time you've really touched on, give yourself time to just wrap your brain around it.
That's it.
How do you even begin to do that, though?
You give yourself time. You go to a quiet place. You go to your favorite place. And you turn everything off and just be with yourself. You cry, you scream, you freak out, you do whatever you need to do as you begin to gather yourself around that. And then you consider the treatment options. But we really want to fix it. We're all about fixing it very quickly.
We're all instant gratification.
That's it. And better to pull back.
And have you found in your practice that when patients really find a way to cope with it and cope with the anxiety and the stress and just the shock of it all, that it helps the actual physical healing too?
Since I'm not a medical doctor, I wouldn't say that, but I do believe that if you feel better psychologically, emotionally, you're just going to do better in general.
But that's true in all aspects of our lives.
No matter what, that's correct.
You just feel better, you do better, you look better, everything's better, everything's brighter. Okay, well, the book is called Emotional Wellness, The Other Half of Treating Cancer. It will soon be available. It's not out quite yet. More information, canceremotionalwellbeing.com/book. And where can people get it?
They can get it on Amazon. They can get it on my website. Amazon is probably the best
Yeah,
because it's everywhere.
Well, it is a wonderful book, and I'm so grateful that you wrote it, Dr. Barr.
much.
Thank you for being here this morning and for sharing this with us.
It was my honor.
Really
Thank you.
appreciate it. Thank you so much. Good luck with the book.
Oh,
Good luck.
thank you so much.
Keep us posted.
Will do.
Okay.
Will do.